Doc Talk. We continue our focus on Breast Cancer Awareness Month, and we want to make sure you know your options when it comes to this deadly disease.
Yeah, this morning our good friend Lara Greenberg has more on an effective device for managing breast cancer.
It's called a SAVI for short, and from what the oncologist tells us, it's a pretty savvy instrument, an implant that can deliver targeted radiation in a woman's breast and work faster and just as hard as regular radiation.
The following segment is sponsored by Geisinger Holy Spirit.
There are few things worse than being told you have cancer, but if you're dealing with breast cancer, there are options.
Patients love it. The breast, after all, it looks very good.
What could women with breast cancer possibly love, you ask? This device, it's called a strut-adjusted volume implant, or SAVI for short, an alternative for standard breast radiation, which is just as effective.
The studies had shown that the tumor control with this versus the whole breast radiation is the same.
The implant is put in after surgery, in the breast cavity where the tumor was removed. It's inserted surgically. Once inside, it's inflated.
These catheters are being connected later on to a special machine where the radiation goes through each one of them.
The SAVI typically stays in for about 5 days with radiation sessions each day in the morning and afternoon. Then it's deflated and removed.
I think that the patients love it because the radiation is being done in 5 days instead of 6 weeks.
Doctors say it's more invasive than regular radiation, but it allows them to target the radiation exactly where it's needed rather than delivering it to the entire breast, which can affect the skin of the breast.
The breast does not look as if it has a sunburn.
Because after a cancer diagnosis and surgery, who wants any more pain? The SAVI is usually inserted after breast surgery and before chemotherapy. If you've recently been diagnosed, talk to your oncologist about this option. With this week's Doc Talk, I'm Lara Greenberg, CBS 21 News.